Andy, this is Dr. P. Ravi Kiran, General Physician, Diabetologist, and Preventive Medicine Specialist at Owners Robotics Hospital, Champapat. As a part of corporate social responsibility, we have been educating our people about the multiple illnesses we have been facing. Today, let's talk about fatty liver. Why are we so interested in fatty liver? Fatty liver is now the most common metabolic syndrome condition present in our country. 1 in every 3 adults, especially in the urban population, are suffering from fatty liver. Consider the load on the healthcare system if every 1 in 3 adults are having fatty liver in a 140 crore population. With at least more than half of the population being adults, there would be at least 15 to 20 crores of population which is having fatty liver. So we have to treat the fatty liver to prevent the next epidemic of health. If there are 9 people in your family gathering, at least 3 of them are likely to have fatty liver. And the shocking part, most people don't know about it. Is 1 in 3 real? In urban India, there is 30 to 40% prevalence, whereas even the rural India, especially in some states, it's nearly matching the same status, where nearly 20 to 30% of the population are having fatty liver. In diabetics, especially, the percentage reaches 2/3 of the population. Up to 60 to 70% of the population can have fatty liver. If there are 3 diabetic patients around us, at least 2 people would be having fatty liver. Understand the burden on the healthcare systems by the fatty liver. Especially it's being increasing in young adults, even seen in non-obese individuals. This condition previously was called as non-alcoholic fatty liver disease, but as the name was not doing better justice for the condition, the name has been changed to reinforce the condition being caused by it. The name being metabolic dysfunction associated steatotic liver disease. It implies, secondary to the metabolic syndrome, where a person develops insulin resistance, they develop steatosis in the liver, which is called as fat accumulation in the liver. That would lead to metabolic dysfunction. That's why it's called as MASLD. Why is it so common? The most common condition being excess refined carbohydrates. I would like to say a proverb here now. Always remember, health starts in the kitchen, not in the gym. The health starts in the kitchen. So whenever we be sure what you're consuming, read the labels, see what you're consuming, and be more mindful of what you eat. Whenever we are consuming excess refined carbohydrates in the form of white rice in large portions, more chapatis, more bakery items, more sugary teas, outside food, packet foods, that would increase the glucose in the body, and this excess glucose is converted by the liver forcibly into the fat. Always remember, you consume whatever in excess quantities that gets converted into fat. It may be glucose, it may be protein, it may be for high fatty food. All of them are converted into triglycerides and fats for the body to store them. And these triglycerides, they get deposited on the liver, resulting into fatty liver. Excess glucose is converted to fat inside the liver. Insulin resistance epidemic. Apart from the unhealthy lifestyles, we are also pairing it with unhealthy diet and lifestyle changes. They have sedentary lifestyle, frequent snacking of high processed food, late night eating, poor sleep. All these conditions would result in high insulin and fat storage in the liver. Visceral fat. Visceral fat is one of the most important concepts which is being ignored by the Indian people. We are the prototypes. We are called as TOFI body types. Thin outside, fat inside. Why are we called that one? Because we have a more chances of developing visceral fat. Even when our BMI is normal, when our BMI is equivalent to the BMI on the Western counterparts also, if we have a BMI of 24 and a Western Caucasian or a white person has a BMI of 24, the fat percentage in the Indian male is substantially high than the Western counterpart. Therefore, the Indians are more prone to higher body fat at lower BMI, thin outside, fat inside, and waist circumference matters the most in the Indian phenotypes, because apart from the waist circumference is more precise for the Indian phenotypes because we have more of visceral fat. And sedentary modern lifestyle, desk job, screen time, no strength training, no minimal walking, metabolic syndrome exposure. All these conditions are linked up to one another. I would like to again reinforce this one. Remember, fatty liver, diabetes, hypertension, obesity, cholesterol, PCOS, etc. These all are a spectrum of insulin resistance. Each one would have multiple conditions in the long term. What happens inside the liver? Whenever sugar enters the bloodstream, there is a rise in insulin. And whenever there is a rise in insulin, the excess sugars are converted into the storage form of triglycerides. And these triglycerides start getting deposited on the liver, forming the fat. And whenever the fat percentage increases in the body to up to our beyond a certain extent, there would be a damage caused by the fat cells onto the cell, causing inflammation in the body. And this inflammation, excess fat deposition would cause inflammation. Excess inflammation will lead to fibrosis leading to cirrhosis, and cirrhosis of liver encompass cancer. So always remember, our metabolic syndrome can also lead us to have cancers. Why you don't feel it? This is one of the most important topic which we have to know. Majority of the times, 90% of the times in grade 1 or grade 2 fatty liver, you won't have any symptoms as such, because liver has no pain receptors. Liver doesn't have pain receptors. The uneasiness you may feel in 10% of the patients in fatty liver is secondly to the stretch of the liver and compression of the surrounding organs, which would cause you bloating sensation, fullness, and that too in a very non-specific form in only a very minority of the patients. Because liver has no pain fibers, you won't be feeling any sensation. Early stages are completely silent because these are gradual changes that are happening in the body and you won't feel any symptoms. And the most common symptoms which would be present are fatigue, malaise, weakness, and non-specific complaints which may not be attributed to the liver, and we would be treating other causes which won't treat the condition. And this is also one of the most common conditions. Mild enzyme overlook elevations are overlooked. SGOT and SGPT are two major hormones which indicate liver failure, liver damage. And the reference values would be generally less than 40 in some labs, less than 36 in some labs. And whenever it is nearly somewhere around 38, 42, we would generally overlook it as some physiological abnormalities. But when we see it from the eagle eye point of view with the previous reference values, it's always on the higher side. It's always mildly deranged. It implies that there is some subclinical ongoing damage going on to the liver, which we have been ignoring. You don't feel fatty liver until it becomes dangerous. This is the major concern we are having with fatty liver. Even grade 2 fatty liver patients also may present to us asymptomatically. How to know if you are on if you are on the 1 in 3? Always ask your well-wishers, always check yourselves, always ask them to self-check. The most important considering factor is waist circumference, especially for males if it is more than 90 centimeters, and for females if it's more than 80 centimeters, they're at a high risk of developing fatty liver, and at the same time other comorbid conditions like BP, sugar, the cholesterol, obesity, etc. If the patient is pre-diabetic or diabetic, or if the triglycerides are more than 150, low HDL, BP borderline fatigue. See, these all the symptoms are interrelated and correlated with one another. Therefore, the symptoms are not clearly demarcated, and this would lead for the patients to miss their fatty liver. What are the blood tests involved? The basic blood tests include LFT, but in majority of the times, the liver function test is completely normal or mildly deranged, which would not raise an eyebrow in the doctors. At the same time, lipid profile, where we see high triglycerides or high LDL bad cholesterol levels, that would strike a bell, probably to suspect fatty liver. At the same time, HbA1c of a high HbA1c, where the patient is in diabetes or pre-diabetes, they have high risk of fatty liver. Apart from these blood tests, the most important screen scan is ultrasound, which would help us diagnose grade 1, give us an exact picture of how the liver is present. Fibroscan is one of the latest scans, which would help us identify the liver condition in more better way than ultrasound. But being said, ultrasound is the basic preliminary test to identify the grade 1 or grade 2 fatty liver. The most important question of the hour: can we change this 1 in 3? Can we come out of the 1 in 3 phenomena, or can we completely reverse our fatty liver? The answer is a definite yes. The earlier, the better the results are. If you are identified in grade 1 fatty liver, you can completely reverse it. If it is grade 2, a partial or a near complete reversal can be attained. The thing to do is evidence-based targets. The foremost important thing is you lose at least 5 to 10% of your body weight, you make good results. Reduce refined carbohydrates, increase protein, do exercise for at least 150 to 300 minutes of exercise per week. That would imply the bare minimum of 30 minutes of cardiovascular activity, at least 5 times a day would be sufficient to attain the 150 minutes. And the more is the better. Strength training in the form of Surya Namaskaras or star or weightlifting or dumbbells or any forms to improve the muscle health and to reduce the insulin resistance, which would reduce the fatty liver. Sleep correction. Make sure that you get at least 6 to 8 hours of good sound sleep without any disturbances to maintain the sleep cycle and to help the body heal from the lack of proper sleep. If you follow these things, you can definitely do diabetes reversal. We at Onos Robotics Hospital, we can help you in guide diet changes, lifestyle changes. We can give you a specific curtailed or based on your lifestyle, we can change or edit the diet and lifestyle changes to suit your lifestyle and attain the targets more easily and more reliably without causing major side effects. We are running a fatty liver reversal program that would be helpful for you or your family members who have been suffering from fatty liver. The timeline would be it would take at least 8 to 12 weeks to see significant lab improvement and 3 to 6 months to see imaging improvement. But definitely after 3 months of your hard work and your discipline, you definitely see a downgrading of your fatty liver. If you have been suffering from grade 2 fatty liver, you definitely come to grade 1. If you have been suffering from grade 1 fatty liver, there are high chances you can completely reverse it back to normal within 3 to 6 months of timeline if you follow the guidance we provide. 1 in 3 adults have fatty liver. The real question is, are you one of them? Even if you are one of them, the good news is early fatty liver is completely reversible. Please do follow up with us to reverse your fatty liver to majority of the extent. Thank you. This is Dr. P. Ravi Kiran, general physician, diabetologist, and preventive medicine specialist at Tonus Robotics Hospital. We are running a diabetes reversal and fatty liver reversal programs, which would be helpful for you to reduce the pill burden and to lead a healthy and happy life. Thank you once again. Once again.